Hey everyone, happy Friday. Hope you've had a great week and we're headed into a great weekend. Here are some updates for this week. First things first, I want to congratulate our September Employee of the Month, Stevie. She is incredible. If you don't follow her work all the time, you should. I love Stevie because I feel like she is just the master of the phones. She is incredible at helping others to cover shifts, and those are things that she was specifically praised and recognized for this month. She filled in for countless shifts. She's always got the best interest of the practice in mind. Can't say enough great about Stevie, and I'm so proud of her for this and all that she does. So congratulations. Get your parking spot, girl. Enjoy. The next thing that I wanted to do was congratulate two other people for some great accomplishments. One is Sam Dore, our nurse. She completed her Purina Weight Coach certification, which is incredible. So great job to Sam. And then also Andrea Ducharme, our nurse. She was promoted to a level 2. So great job to all three of those ladies this month, especially. This week we started a really cool project that I'm very excited about. Sam, Alex, and myself have all been working on revamping our reminder system and making that a little bit better. So it was kind of prompted by our vaccines changing in those packages. It showed us that we had some areas of vulnerability where we weren't quite reminding appropriately for all that we could. And it really snowballed into a great project where we've revamped the way that we send out reminders for heartworm and flea prevention. So that's what I wanted to focus on. Before, we had been reminding for individual products. So Simparica would get a reminder that said, refill your Simparica, and so on through all of our products. Now we've grouped those into heartworm and flea combination, or just flea preventative reminders, which does a couple of things. One, if anybody comes to refill a product that we don't have anymore, it's not as uncomfortable to try and break into that, and also to have to remember to go and manually fix those reminders, take out the old, make sure that the new went in. So that's going to be corrected. But also with the heartworm prevention reminder, it's a great way to guide clients into that conversation instead of just falling into the same refill type of pattern where we get a little complacent. We can actually have a conversation to remind people that we have changed our primary heartworm prevention to ProHeart, and again, you land right there in that great conversation. The last thing that revamping our reminders right now is doing is it's giving us a great look at the chronic diseases that we manage and that we monitor patients for. So some examples of those are maybe patients who are long-term on an NSAID like Daramex or Metacam or any of those, where we want to monitor their blood work annually. Or patients maybe with renal failure or heart failure or any of these types of diseases where we're looking specifically at lab work more frequently than average. So for those, we've created some great reminders as well. The only thing that I would remind you about is that those are recommendations. They're not required to refill a medication. The things that are required to refill a medication are an annual exam. So these reminders will go out and they may be left overdue, but it's a great cause for a conversation with clients to make sure that they understand what we're recommending, and it gives us a great opportunity to capture those great opportunities for patients. And we'll be able to do some great marketing with that all as well too. What I've attached to the training is a guide to tell you how frequently we're going to monitor those diseases and with what. So I want you to take a look at that. It's going to be the same thing that's affected in our reminder system too. Also, we have a new alert code. It's called New RX that we will have the doctors be updating in patient records. This is if they change a patient's dosage by phone outside of a refill. It's meant to be to tell you what the patient's current dose of medication is. I love this for the resort as well as for the hospital and the customer care teams. It's just great for everybody because right there in that patient's record, when you see the code New RX, there's a specific format that's in the text of this training I want you to look at. It's going to tell you exactly what that patient's current dose of that current drug is, and there'll be one for each of the drugs that we choose. Very, very brilliant, whoever came up with that. I love it. All right, so the next thing that I wanted to talk about was some upcoming conferences that we have. As I mentioned before, we have multiple team members going to multiple conferences this fall, and it really kind of kicks off next week. Dr. Ryan Andrews, Brooke, and Lindsay Count are nurses. They're going to the International Emergency and Critical Care Symposium in New Orleans. Myself and Laura are going to the AHA conference in Colorado. And then also Dr. Mark and Dr. Patrick got invited to a private veterinary meeting, and they're going to be in California on Monday and Tuesday. So all the details are in the text so that you know who's coming and going and what they should come back smarter in, and we can follow up with those at that point. But I'm really proud for everybody going out there and just continuing to self-improve. All right, so as a final kind of notification for this week or request for you, everybody knows that we're always trying to grow our practice and remind the community of what we're here for and how available we are and just getting the good work out. I think it's really important that everybody understand that when we say marketing, for lack of a better term, it's really more of awareness in our community of what we're here and what we're doing and how great we are. And that is not a one-woman job. It is not just my job to put that information out there. It's everybody's, and it's your responsibility. So one thing that I'm going to ask of you as a team member is to try and over the next week join the app called Nextdoor. You can use it from a website, you can use it from their app, you can put it on your phone or just do it here at work. But if you join the Nextdoor, it's a neighborhood app that maybe some of you use. It helps you to refer businesses within your immediate area. If you could go on Nextdoor and recommend us as a veterinary hospital, boarding facility, pet care facility, and then you can nominate us as the best. We've been nominated as the best in some neighborhoods, and it really just helps to get word out about our practice. I think it's perfectly acceptable for you to write a review for us based as a team member and just be honest with what you feel and what you feel we offer well. Those types of small things make a big difference, believe it or not. The other thing that you can do if you're looking for more is go on your own Facebook and Instagram and invite people to like our page. Invite all your family and friends. That's how social media works, is it generates more exposure. So those are two things that you can do right away that can make a huge difference and make it easier for us to fill the schedule and keep our team busy, which is an essential part of business. So go out there and do some good with that. Thanks for your time. I hope you have a great weekend. Take care.